Hello, everyone. Thank you for joining us for tonight's free webinar, Facial Motor Points and Microneedling. My name is David Hirsch, and I'm the Chief Marketing Officer and Head of Customer Experience at L.A OMS. I hope everyone is doing well. L.A OMS has been supporting acupuncturists for over 40 years. Part of that support is through free webinars like this to provide educational opportunities that are taught by some of the most renowned educators and practitioners. And tonight we have a great one. Before we get into it, let's just take a moment to acclimate ourselves to the webinar room. To the bottom right of the screen, you're going to see two tabs, questions and chat. To connect with other attendees or to notify us of any difficulties, please use that chat tab. At the end of the presentation, we'll use the chat tab. Oh, bear with me one moment. We'll use the chat tab to address any specific questions. We'll also post a promo code specific to the event. If you have any questions for Michelle Gellis, please use the questions tab. Your questions will be used by a moderator at the end of the lecture during our QA session. Now for our guest speaker. Michelle Gellis is a board-certified acupuncture physician in practice for 20 years. She was on the faculty at Johann University doctoral program teaching facial acupuncture. Michelle is a former faculty member and clinical supervisor at the Maryland University of Integrated Health. She holds a Bachelor of Science degree from Seton Hall University in computer science and a Master's degree of Science in acupuncture from the Traditional Acupuncture Institute. Michelle founded facial acupuncture classes in 2006, where she teaches all aspects of facial acupuncture, including facial motor points, cupping, gua sha, safety and ethics, scalp acupuncture for treating neuromuscular facial conditions, and microneedling. She's been published several times in the Journal of Chinese Medicine, Acupuncture Today, and in many magazines. And with that, I'll pass it to Michelle. Thanks, everybody. Enjoy.
Hi, thank you, David. And thank you to L.A OMS for hosting tonight's webinar. And I cannot see my slides. Are they supposed to be visible? I can chat while you try to pull them up. There we go. Okay. So tonight's talk is going to be on a very interesting combination of topics, and it is facial motor points and microneedling. So these two topics, you would think, are not really related to one another, but we are going to pull the two of these together in a very interesting way. I have posted a slide here with my social media. If you want to find me on Facebook, I have a group. I know a lot of people left Facebook during the pandemic. It seemed people just kind of dropped off of Facebook, but I do have a very active group on Facebook called Facial Acupuncture with close to 10,000 members, where I post informational videos, and there's lots of lively conversation going on and information about upcoming classes. I'm on Instagram at Michelle Gellis, and my website is facialacupunctureclasses.com. David had mentioned my publications. These are a few of my publications in the Journal of Chinese Medicine, and many of them elaborate on some of the topics that I will be discussing this evening. David also mentioned a few of the classes that I teach. I have a comprehensive facial acupuncture certification, and which includes facial cupping and gua sha, and some advanced techniques, Chinese face reading, and microneedling. I also teach a 2-part class on treating neuromuscular facial conditions, of course, on the anatomy of our expressions. And I am a classically trained Worsley 5-element acupuncturist. So I delve deeply into our expressions and how they affect our emotions and vice versa, and how to treat some of the underlying physical expressions and some of the symptoms. I also do a facial acupuncture self-care for acupuncturists, safety and ethics for the face, which meet your safety and ethics requirements, and microneedling, and looks like I have self-care there twice. I also offer a advanced certificate program, which includes monthly live mentoring sessions, and I have in-person hands-on training pretty much every month. I am in a different place, and we can go ahead and go to the next slide.
Before we proceed, can you just we're just getting a sound effect that might be distracting. So can you
get rid of that
in the chat on the bottom right where the chat is, if you hit that, go up, there's a bell. Just hit the mute on that. And then that should do it.
Right. The next class will be in Boulder, Colorado on September 25th. And in 2022, the way my hands-on classes work is you watch some recorded lectures and then you show up for a full day of hands-on supervised practice. Next slide. So the first topic will be facial motor points. Facial motor points, if you're not familiar with motor points, facial motor points can be used for treating both neuromuscular and cosmetic acupuncture concerns, or facial concerns rather, using either acupuncture points or points in the muscles, which we'll talk about in a moment. All of the facial motor, all of the face is innervated by the 7th cranial nerve. The only exceptions are the masseter and the temporalis. So when you're thinking about facial motor points and which one you need to use in order to either affect a cosmetic concern or a neuromuscular concern, is you have to look at which muscles are affected, and then you will determine which motor point you need to use based on which muscle is not functioning properly. And motor points are good for any condition involving paralysis, whether it's Bell's palsy, if your patient has had a stroke, or if your person has some sort of a congenital condition. It can even be ptosis. People are born with congenital ptosis, whether they've had a brain injury, anything that affects the movement of the face. Facial motor points are great for that. And it also helps for a muscle that is very tight. It helps the muscle to relax, much in the way a neurotoxin like Botox would. When you're needling, it is important to needle into the muscle, but you do not want to go through the muscle. The motor points are located at the most electrically excitable part of the muscle. So it's where the motor bundle is attached. So if this is the muscle and this is the nerve, where the nerve goes into the muscle, this is where the motor point is. Now, motor points are not trigger points. What a trigger point is they're more like our ashi points. It's where you'll go along and you'll feel a sore spot and you'll put a needle there. That's not what a motor point is. Motor points are like a reset switch for the entire muscle. Unfortunately for us, many motor points are acupuncture points. And I say fortunately because it makes it easy for us to find them. Facial motor points will treat the facial muscles, and depending on how you're using them and where they're located, they can also work with the facial fascia, and so it can help with a lot of skin conditions. And we get wrinkles frequently, a lot of those deep wrinkles and crevices because muscle is attenuated, and that is how Botox works, right? It relaxes the muscle, and then those lines between your eyebrows or on your forehead, sides of your face, your chin, even your neck, the muscle becomes tight, and then the skin kind of ripples over it. By treating the motor point, it allows the muscle to move more freely and properly, and the skin will lay flatter on the muscle. So it improves the appearance of the skin by improving the muscle function. And some facial motor points are great. Can you go back? Facial motor points are great for skin conditions that are muscle or fascia related, because our face is the only place on our body where our skin is connected to muscle. And the way that that happens is through this layer called the SMAS layer. It's the superficial muscular aponeurotic system. And the facial fascia is interwoven with all of this. And by needling in, if there's any fascia that has become very stiff or hardened, you can help to break that up. So if you have a condition that's very skin related, like acne or a superficial scar, some sort of skin discoloration or dyschromia, really fine lines, then facial motor points aren't really the way to go. That's when you would use the microneedling, and that's what we're going to talk about next. Now you could go to the next slide. So the first, I'm only going to talk about a couple of the motor points because we don't have a tremendous amount of time tonight, but I'm going to talk about a couple of very effective motor points for some of the facial wrinkles. And one of where, well, it's a pair of muscles on either side of the chin, and those are the mentalis muscles, and they are responsible for both elevating the lower lip, so you can push your lower lip up against your top lip, and also protruding your lower lip, like if you were pouting, like that. And it also can create wrinkles in your chin. So if you recall, I was talking about emotions and the face. When you think about someone who's very frightened, they can have this puckering in their chin. There's actually a term for it called popcorn chin, and this can occur if someone is frequently afraid. Their chin will actually quiver. So by treating the mentalis muscle, it helps this muscle to relax and to get into more normal functioning. The motor point for the mentalis muscle is on either side. It's a half sum lateral to Ren 4, and you would needle straight in. And I'm sorry, I'm trying to change the slide myself. You can go ahead and go to the next slide. And here's a video. It's a little jumpy, but you'll get the idea. I had a student in one of my classes. I think I was teaching in Asheville. And I had a student who had Bell's palsy many years previous. And one of the long-term effects that had not quite rectified was she had trouble kind of closing tightly part of her lips. And she would notice if she was like brushing her teeth and she went to spit, she'd like kind of drool a little bit out of one side. And she couldn't like push her lips together evenly. If she pursed her lips together and blew out, air would come out. So I was working on some of the cosmetic acupuncture points on her. And at the same time, I said, well, let me try this motor point. So I did the motor point for the mentalis. And you can go ahead and start the video. It's a real quick video, but you can see when I put the needle in, the needle immediately, as soon as the needle went in, this is really slow, but the needle started jumping, and then I twisted it just a tad, and you can see the muscle jump. As soon as I just gave the needle a little twist, the muscle jumps. If you want to see a better visual of this, go ahead and go on my social media. You'll find I've posted this a few times talking about the mentalis muscle. Next slide. So this is what I was talking about when I was discussing the wrinkles on the chin and what they can look like. You see all this dimpling, and if you ever thought about a young child, like think about a young child when they're really afraid, how their bottom lip trembles and their chin gets all tight. So if someone is in this energy frequently, this kind of kidney energy where they're afraid, they can develop these dimples in their chin. And so that's when something like this can come in handy. The next motor point that I want to discuss are the motor points for the frontalis muscle. And the frontalis is a thin muscle that goes, there's two frontalis muscles, one on each side over the forehead. And its job is to raise your eyebrows, and it causes forehead wrinkles. So you will see these a lot in people who are very inquisitive. And over the years, I've noticed this a lot in some of my patients who were attorneys. They are asking a lot of questions. Their eyebrows are up all the time, deep, deep furrows. Also, it can come from surprise. So someone who's a water constitution type, whose eyes are wide open a lot, the widening the eyes causes the eyebrows to go up, and they can develop those lines as well. So in order to locate the frontalis muscle, you would ask your patient to raise their eyebrow, and you can feel the margin of the frontalis. And then the good news for us is that the motor point is gallbladder 14, which is right in line with the center of the pupil, right in the center of the frontalis muscle, and you just needle straight in and you stimulate the needle a little bit. And I have a video on this as well. Hopefully this one shows up a little better than the last. But again, on my social media, I have this several times. So go ahead and press play. So this patient, their eyelids were drooping, and I put the needle in, and yeah, it's not showing up on this video. My apologies. It shows up fine when you just play it normal. I don't know what's going on, but take my word for it. It works, and I don't know. Maybe at the end when we're all done, I can do a screen share and I can pull it up and show it to you guys. Go ahead and go to the next slide. So I'm just showing some forehead wrinkles here. This is what I mean by forehead wrinkles. And this individual definitely has some deep ones. And you can almost see the margins of the frontalis muscle on this person. I don't know if it's a man or a woman, but on this individual. Go ahead to the next slide. So this was a patient of mine, and she had come to me for years for various issues with shoulder, neck, wrist. She was a pharmaceutical rep, carried heavy bags around a lot. And I think I'd been treating her for about 15 years. She was now getting into her mid-40s. And she noticed that her eyelids were beginning to droop, because what happens is as the frontalis ages, and as our eyelids age, they start to come down and eclipse our eyes. And people will call this hooded eyelids. She asked me, she had seen my brochure in the waiting room, and she said, does this cosmetic acupuncture stuff really work? And so I said, well, go ahead and get on the table. And I just treated her left eyebrow. So I did the motor point, gallbladder 14. I also did Yu-Yao, gallbladder 15. I think I did bladder 4, threaded back to bladder 6, maybe the eye reflex point, gallbladder 18. And I left them in for a little bit. And I came back in, and I said, do you mind if I take a picture? And I took the needles out and I took a picture. And then I handed her a mirror, because I keep a mirror in my treatment room. And she looked at it and she was horrified. I said, what's the matter? She said, well, I can't go home like this. So I did treat her other side. And then she ended up coming to me for cosmetic acupuncture after that. So it does work. And pretty dramatically, facial motor points can really cause quite a dramatic effect on the muscles. The next muscle group are the corrugators, and these are very important muscles when it comes to pulling the eyebrows together, and those lines that we get between our eyebrows. And some people it's 1, on some people it's the 11s, and on others it's the 111s. So these muscles pull the eyebrows together. They work in conjunction with the procerus, but corrugators, looks like my little arrow is not in the right place. This is the corrugator right here. And the motor point is just lateral to bladder 2. So imagine this little triangle is down here. Not quite sure how this happened, but this is the corrugator. The procerus is right here. And actually yin tong is also a motor point. So using yin tong and the motor point for the corrugator bladder 2 together can really help to relax this whole area and help to get rid of some of those forehead wrinkles. Oh, thank you so much. we moved yin tong and the motor point to its proper location. That was great. Yeah, because we all know yin tong isn't out in the hairline somewhere. So, much appreciated. So here's a picture of the wrinkles I was just referring to. So here's the 11s. And they say, whoever they are, this is more gallbladder. And then if you have the one line, it's more liver. They call this the dagger. So this is right into the procerus, whereas these are more into the corrugators. So the next topic we're going to talk about is microneedling. And microneedling can actually take two forms. One is in the form of a derma roller, and the other is with a microneedle pen, which has become wildly popular and very successful in our universe. And in as far as I know, and you would want to check with your local acupuncture board, association, powers that be where you live, microneedling with a pen is within our scope. I know derma rolling is within our scope within the US. I have so AcuLift derma rollers, which L.A.C sells. That's my company. And AcuLift now has a microneedle pen. So I'm just going to jump right into microneedling with a pen and what it's good for, why we would use it. For those of you who are already doing cosmetic acupuncture, why would you want to bring that in? And how does it differ from cosmetic acupuncture, or how does it differ from the motor points? So microneedling with a pen is really wonderful for fine lines. All those fine lines that you get around your lips, acne scars, loose skin, enlarged pores, the crow's feet area, lip wrinkles, skin discoloration like melasma, dark spots, stretch marks, pretty much anywhere on the body, and also can help with hair restoration. And this is by no means a comprehensive course in microneedling. I do have a 4-hour microneedling course, but this is just a kind of an overview on what it is, why you would use it, and how you can incorporate it into your practice. So what is microneedling? What does it do? Microneedling actually stimulates your body's own collagen production. When your body recognizes that it's been injured, it will produce collagen. And the other thing that it does is it also increases the absorption rate of any product that you are going to put on your skin, like those expensive serums that we buy, that we put on our hands and we put on our face. It increases the absorption rate by up to 1,000%. And these are not just claims I'm making. These are based on clinical studies. And I have links to all of these on the AcuLift website. And certainly the Google has plenty of these as well. So what are some of the benefits? Very little downtime. So when someone has microneedling, essentially they go home that night. You don't want them to go out in the sun. I mean, they can go out, they'll be red, like a mild sunburn to moderate sunburn, but by the next morning, they'll probably just be a little pink. Very low risk if done properly. You don't want to go and buy one of these pens online and then just try to wing it. You absolutely want to get trained. There's very low risk, and it creates collagen naturally. Again, stretch marks, acne scars, hair loss, eyebrows. I have a picture, I think, of my before and after with my eyebrows. Improves wrinkles on the neck. I love it. For my 61-year-old neck, it's great. And a lot of us, just because of the nature of our lives, we have these phones, we're looking down all the time, wrinkle, wrinkle, wrinkle. And it helps with wrinkles on the neck. It's not terribly uncomfortable for most people. A little numbing cream. A lot of my patients I don't use numbing cream when I work on myself, and the results last a long time. Results can last from a course of 4 to 6 treatments. Results can last up to 5 years. So how does it work? The needles go up and down. They create tiny microchannels on the surface of the skin. Those microchannels will stimulate a healing response in the skin, which increases the production of collagen and elastin. And the more collagen and elastin you have, it causes your skin to become firmer and will help with reducing the scars and smoothing out wrinkles over time. We lose 1% of our collagen every year from the time we're about 25. So anything we can do to continue the proliferation of collagen is great. And the nice thing about them is they can be used on the face, the neck, the chest, the scalp, stomach, thighs, arms, back of the hands. I live in a 55 and older community now, and a lot of the ladies have been coming just to have their hands done. They've asked me, like, why don't your hands have any of those dark spots on them? Because once you turn, into your mid-50s, a lifetime of sun damage from bicycling, being outside, we tend to put sunscreen on our faces, but not so much on our hands. So our hands can get dark spots, and people will come to me just to have their hands done. The way that the collagen induction therapy works is it actually stimulates your immune system and the wound healing mechanisms. They're little micro wounds, and it triggers this cascade of inflammatory response that creates subsequent reactions. When your skin's nerve receptors sense that these needles have gone in, that there's some sort of an injury, it will respond to that. So this is a kind of a cross section. This would be the microneedle pen and the needles going into the skin, and the wounds that are made are really tiny, and it creates these undifferentiated cells. They're skin stem cells, and it creates new fibroblasts and other wound repairing cells. But there should not be any bleeding. This all takes place right on the epidermis. That's fine. You can go ahead. Next slide is a picture of the AcuLift micropen. And again, L.Ac carries these. The pen itself is right here. It has an adjustment ring for the needle depth. And then it comes with 2 rechargeable batteries. This is the recharger right here. And then this piece right here is a piece that you would plug in. And in case your batteries, in case you wanted to plug it in for some reason, the batteries last about 4 hours a piece. This is a picture of the needle cartridges. So the pens come with needle cartridges, and each needle cartridge has 16 needles on it. And there were many choices. When I was designing this pen, there were many choices in how many needles did I want in the cartridge. And all the research I did said that 16 was a really good number for, if you think about aerating your lawn, you want as many holes as possible, but if there are too many, then it's not going to elicit the wound healing response. You're not going to get as many channels. So, so you would use this sort of a cartridge on the cheeks, the forehead, the chin, around the jawline, and these are made out of surgical steel and titanium. The reason they're designed that way, the titanium, the surgical steel gives it strength, and the titanium is something, some people are actually allergic to stainless. So the titanium helps to prevent any allergic response. And I can go back one more time. And, oh, no, actually, go ahead. Sorry. I'm so used to being in control of my slides. Okay, so those were the 16 pin needles. These are nano needles, and what the nano needles are used for, so the other needles can be used pretty much anywhere, but you don't want to use them on the red part of the lips. They could cause bleeding, and you don't want to use them inside the orbital rim. So these are great. You can use these nano needles almost every day on the red part of the lips, inside the eyes, or anytime you just wanted to do an exfoliation. I use mine a few times a week to help, like I'll put serum on and then I will treat myself with the nano needles. And they are 110 nanometers, which is 1/1000th the depth of millimeter. So they are really, you can just barely see these. They're like little cones, and I like to think of them like scrubbing bubbles for the skin. They just work on the stratum corneum, the very top layer. So again, when you buy a microneedle pen, it comes with 2 batteries and a plug. One of the interesting things about these devices, which was part of the reason why I branded these, is when I was working with my manufacturer, they explained to me that the connector that works with the pen, it has 3, it's kind of hard to see in this picture, but it has 3 little knobby things here, and it also has 3 holes. So these little knobby things on this bayonet go into the pen itself, and then these 3 holes will connect with these plastic knobs on the outside. So you push it on and you twist it, and It makes a very tight connection. You don't have to worry about anything flowing back into the pen. You don't have to worry about the needle cartridge coming off. And the needles themselves, I don't know if you can see on this slide, they are very thin. They're only 0.18, which means that there's very little pain, and the holes that they make are not very big. Next slide. So when you're working with your patients, you want to set realistic expectations. You want to look at their skin type, how old they are, their lifestyle. Are they out in the sun all the time? Are they drinking water? Are they getting rest? Because this is all going to play into the type of results that they are going to get. You want to look at their skincare routine. Are they taking care of their skin? Also their genetics. People with darker skin are going to get results faster than people with lighter skin or thinner skin. And also their TCM diagnosis. When I do microneedling on someone, I'm not just treating their face. I go through a complete TCM diagnosis. I look at their pulses and their tongue, and then I do a full body treatment, and then I will do microneedling on their face. And for some individuals, I can do a section of their face, and I might do some cosmetic acupuncture on other parts. You just don't want to do microneedling and cosmetic acupuncture in the same area on the same day. So again, this is the Reader's Digest version. I'm just going to kind of go through the protocol so you can get an idea of what it looks like. So normally when I treat patients, I don't wear gloves, but when I am doing microneedling, you have to wear gloves. There can be pinpoint bleeding. That is not the clinical endpoint. The clinical endpoint is pink on the skin, but you want to make sure your hands are clean and you glove up. You're going to clean their face and make sure their hair is back. Apply numbing cream that stays on for 15 or 20 minutes. Then you can put on any of your body points, feel their pulses. Once the numbing cream has been on, you would take that off, and then serum is applied in small sections, and you would adjust your settings on your pen depending on where on the face you were working, how deep the needles are going to be set. You want to hold the pen upright. You don't ever want to tilt the pen because you could dig into the skin. You don't need a lot of pressure. These pens do all the work themselves. You just are there to glide the pen along the skin about 1 inch per second. And if they have a deep line or wrinkle, you're going to spread the skin, and you're going to work in that area. You always want to work from the top down, and you're going to work along the perimeter of the face because you want to build collagen in that area. It is good to start on the forehead, and the reason why I say this is that it can be a little sensitive. So you kind of get the worst out of the way in the beginning and between their eyebrows. And then you are going to work, so around the forehead, the temples, the lower part of the orbital rim, the cheeks, in front of the ear, around the lips, not the red part of the lips, and then on the nose, the chin, the neck, and the chest. And again, the clinical endpoint is not bleeding when you are. So what I do is I'll work in an area, and then I'll go to another area. And if the first area has not gotten pink yet, I will go back and I will work on it again. So I'll give it a pass, go somewhere else, and I wait and see, has it gotten pink? If not, I'll do it again. When you're all done, I have an aftercare spray that works with the pen, and it is aloe and arnica, and it is fabulous. Then any acupuncture needles you have in, you want to put those in, and then you give your patient a take-home kit and their instructions, and that's it. The entire process takes about 20 minutes once you've taken off the numbing cream until you're done. And next slide. And you can, I tell my patients they will probably need 4 to 6 monthly treatments, and that I typically charge $350 for a treatment. I let them know what to expect. Their skin's going to be red for about 8 to 12 hours. No exercise because you don't want them to sweat. It can irritate the skin. No sun, no makeup. Don't wash your face. Just let all the serum absorb. They can put on their aftercare spray. They might have a little peeling. Their skin may be sensitive. They can use the aftercare as much as they want. And typically they'll see results within about 2 weeks, but they shouldn't do the treatments more than once a month. Next slide. In addition to some pinpoint bleeding and redness, they might have some itching or burning, a little irritation, or some pigmentation changes, and that's all perfectly normal. This is just a quick photo of everything that comes with the AcuLift system. It also has a really nice metal box carrying box that it comes in. I don't want to take up a lot of time talking about it. I already showed you this. And the cartridges comes with 3 different serums, a large vitamin C hyaluronic acid collagen serum, and 2 other serums, and the calm spray, and this is for your back bar. Everything is organic and vegan, and this is the patient take-home kit. You also get training, marketing information, stuff for your website, brochures, and before and afters. And the pen has a 2-year warranty. There are some pictures of, so this was before, and then this is me working on the patient's chest. And I just wanted you to kind of see what it looks like after the treatment. You can see it's just red. It's not all bloody and horrible looking. And by the next day, they might have a little pink, but some of these dark spots will start to dissipate. Usually around by the 2nd or 3rd treatment, they'll be completely gone. There are some more pictures, acne, scars, and some face wrinkles, crow's feet, wrinkles on the cheeks. And this is me. This was me before microneedling my eyebrows. And you don't actually have to look at the after. You can see the after. It's right here. I do not have any, I have not had my eyebrows microbladed. I have nothing on my eyebrows right now at all. 0. And what was happening as we get older, we lose estrogen, and over time, our eyebrows just thin out, especially the tails, this part right here. So I virtually had no eyebrows, and here they are. In fact, I had to start plucking them for the first time in 20 years. So again, I charge, I'm on the west coast of Florida. I charge $325 for a session, or a package of 4 for $1,200. And my patients are typically in and out of my treatment space in 20 minutes or so. I usually start them with the numbing cream, either on the table or you can even start them in your waiting room. And that's it. So I'm going to open it up.
Yep, we have a number of questions. We're going to try to get through them quickly. We have about 10 minutes. We could go a little bit over. So we'll get right at it, Michelle. Thank you so much. That was wonderful. A lot of great questions here. How many days after microneedling can you have your patient come back for gua sha or facelifting massage?
So I would wait a full week. And it depends on your patient. What I'm finding here with my older patients is their skin is very thin and it is taking them longer to recover from the microneedling. So you want your patient's skin to be healed. You don't want to see any, it could be slightly pink, but you don't want to see any areas that haven't healed over yet. Like if you were working on a dark spot, you might go a little deeper and there could be some healing going on. And so you would want to wait until their face is completely healed, but a minimum of a week. So what I do with my patients usually is microneedling, then cosmetic acupuncture, cosmetic acupuncture, cosmetic acupuncture, and then microneedling. So this helps with the lifting because you're not going to get that from microneedling. You're not going to get a lifting. So it helps with the lifting, the muscles, the facial fat, the fascia, everything that goes on a deeper level. And the microneedling really helps with all the fine lines.
Okay, thank you. Next question is from Vanessa Tippett. Once a patient waits the initial 24 hours, any products to avoid after microneedling?
Typically 24 to 48 hours, they can go back to whatever they were using. The only caveat would be if they're using a prescription product, they need to speak to whoever prescribed it. The good news is that dermatologists now are familiar with microneedling and they will know the answer to, can I go back to my Retin-A or hydrocortisone or whatever they might be using, prescription products on their skin, because it's going to leave the skin more open than before they had the microneedling. And a lot of my patients that are using Retin-A or other prescription products have been able to go to a lower dose of the product or less frequent use just from microneedling.
Okay. Each cartridge is disposable, is that right?
Absolutely.
Okay. What type of pigmentation changes or side effects of microneedling have you experienced?
I have only seen positive changes. I have not had anyone, even if they've had dark skin, have any negative reactions. And maybe it's the products because they are all, again, they're all organic vegan products that are all formulated for this specific purpose. Maybe it's the technique that I teach, which is very gentle microneedling. Maybe it's just good luck, but I've done I've done a lot of research. I even have a patient who has had a lot of skin cancer removed. So she had hypopigmentation all around her mouth and a few areas on her face. It was almost like vitiligo, where she was very white in these areas. And I did microneedling on her and she was fine. She didn't have any strange reactions.
Do you adjust the needle depth for different areas?
Yes. And in my class, I go through every area of the face and what the ranges are, different skin thicknesses, and how you should adjust the pen accordingly.
Okay. Have you used any red light therapy for healing?
I have not, but stay tuned. That's all I'm going to say right now. But I have not. Up until the pandemic, I really wasn't about having a lot of gizmos and gadgets in my treatment room. I just wanted needles. But then I started messing around with these microneedle pens, and I kind of got hooked. So it's kind of a slippery slope to the red lights.
Okay.
So we'll see what happens. I've heard good things.
There are two questions that specifically talk to insertion obliquely versus going straight in on GB14. Can you clarify that?
So when I'm doing gallbladder 14 as a motor point, I assume that's what they're talking about. I typically go straight in, and unfortunately that video just you couldn't really see, but I went in and I just stimulated the needle slightly. And maybe because when I do cosmetic acupuncture, I'm always sitting behind my patient. It might have been on a slightly oblique angle. But I usually just go straight in, and I'll give it a little twist, and the muscle just starts to jump. So
okay. How do you use this for hair restoration, if at all?
So, again, that's a whole big, long topic, but the Reader's Digest version is you're going to want to kind of push the hair back and just kind of work in that area. And you can either, depending on how much, if they don't have any hair, you can go back and forth. If there is hair and it's just thinning, then you would want to use more of kind of like a pecking motion, because if you're kind of digging back and forth into the hair, you could actually break some of the hairs that are there.
Okay. A couple of questions in the same spirit. Sorry if we don't get to them exactly as written, but what numbing cream do you recommend or use yourself?
So I've tried a couple. I buy my stuff on Amazon, and I've used Uber Numb, and it's UBER. I don't sell any numbing cream, but I use Uber Numb, and there's another one called I think it's called BLT. It's benzocaine, lidocaine, tetracaine. It's a lot more expensive, like 4 times as expensive, but it's prescription strength. So for your patients that are a little more sensitive.
Okay. Another duplicate for you, Michelle. Any contraindications for microneedling, such as pregnancy, open wounds, okay with retinols, etc.?
Yes, and that is a big, long discussion. Really don't have time to get into all of them, but there are a lot of contraindications, and there's too many to talk about right now. So you don't want to just jump into microneedling unless you've been trained, and that is probably the most important thing takeaway from tonight is if you're going to start microneedling, get trained. If you don't get trained by me, get trained by someone, but get trained, because you need to know all the red flags, side effects, contraindications. Otherwise, you're really leaving yourself open to a lawsuit or something.
Couple more. Do you need to work around Botox injections a few days after Botox? Also, should you avoid injectables such as lips or cheeks?
So with Botox, I would never microneedle or needle on anyone's face that's had Botox for a minimum of 2 weeks, but I usually wait a month. And they need to find out from whoever injected them exactly where that Botox was injected, because Botox can travel, and they may think they know where it was injected, or they may just forget, and the microneedling will make the Botox wear off. If you do it too soon and then they have an adverse effect to the Botox, then you're the one who's going to get blamed. They're going to say, you know, my eyelid is drooping and it's your fault, when it had nothing to do with what you did. It was the Botox. So, and with filler, definitely, again, they have to speak to whoever put that filler in their lips, cheeks, wherever it was put. There's a lot of different fillers out there. Some of them work immediately, some take time. With filler, once it's settled and done doing what it's doing, which could be a couple of weeks to a couple of months, treating the skin level should be safe, but they have to check with whoever did the treatment. There's too many different things out there for us to guess whether it's Bolotero or Restylane or Radius or Sculptra, or there's dozens and dozens, and it's just not this isn't, you know, what we were trained in.
Okay. When should we apply skincare after microneedling? Right after the procedure, or wait a few hours?
The day of microneedling, really just the aftercare spray that I give my patients, a little aftercare kit. And there's also, if they can tolerate it, there's a serum and a lotion that I provide that has pearl powder in it, arnica, CBD, and other things to help the skin. But they don't want to be using whatever they normally would use right away, usually 24 to 48 hours. But
Okay.
they shouldn't wash their face or do anything right away.
Are your patients also taking collagen supplements, and do you think that's something a patient could stop taking with microneedling treatment?
There's a lot of debate on collagen, oral collagen supplements, and how much of it actually makes it out to the skin. It's really great for your joints. But as far as the skin, it's questionable whether it does much of anything. There's no rhyme or reason for whether or not they should stop or start using it. If my patients are taking the collagen drinks and they want to stop, they should stop. If they don't want to stop, I don't get involved with the whole collagen thing. Mm-hmm. I do encourage them to do a lot of other things dietary wise. Our body makes its own collagen from protein and vitamin C. So,
can needling yin tang cause eyelid drooping?
No, not in my 20 years of experience. I have never seen that. If anything, it has the opposite effect.
Okay. How does microneedling compare to microabrasion?
I don't know that I know what microabrasion is, so I can't answer that.
Okay. Would you use different size microneedles at the time of treatment for face versus stretch marks?
No, but I would use a different needle depth and a different technique as far as speed and things of that nature.
Okay. If a patient has done microdermabrasion or facial peels, how long do they need to wait before doing microneedling?
They would have to speak to whoever did those things to them and make certain that their skin is healed, and they would want to tell that person they were thinking of getting microneedling, and is it safe?
Okay.
Because the important thing is we can't guess based on a word that they're throwing out at us. What was actually done and at what depth? And I always err on the side of caution. And patients think one thing was done. Oh, I just had a very superficial laser and I didn't notice anything, so I'm fine. And then it turns out that they had a very deep level laser and it's going to take 2 days before the peeling starts to happen. And then they come to you, they have an adverse reaction and all hell breaks loose. So it's very important that if people are having things done to themselves, I'm not talking about just like a basic facial, but if they're going and they're having medical or medi-spa treatments done, that they get their blessing from whoever did it, and that you know what's been done, and that you have a release form. In my classes I go through, I have a very specific release form that goes through every single thing and what they did and what they're taking and what conditions they have.
Thanks. How many cartridges do you use per patient visit? Do you use a separate cartridge if you're working on the face and the chest, for example?
I normally would not work on the face and chest at the same treatment. It's a lot of numbing cream. It's just a lot. So I would use a separate cartridge because they'd be coming at separate appointments.
Excellent. I think we probably have time for about 2 more questions. Can we microneedle patient with active acne outbreaks?
If it's not pustule, you can. I wouldn't microneedle over anything that was red, raised, angry, inflamed. So if they had a little acne here, you could microneedle everywhere else, and you certainly don't want to microneedle over anything pustule.
Okay. Last question, and for anybody's questions who haven't been answered, please feel free to reach out to Michelle via social. We can provide her email address.
Go to my Facebook group, Facial Acupuncture, and ask away. If I don't get right back to you, there's 8,000 acupuncturists who've taken my classes who will. But I do try to get to people's questions here.
Okay. And last question for tonight. How many sessions did it take for your eyebrows?
God, I get asked that all the time. And it's funny because I was just kind of doing it and I wasn't keeping track. I was actually surprised. Like one day I went to put my eyebrow pencil and mascara on, and I looked at myself and I thought, oh, it must be on from yesterday. And then the next day I went on and I went, okay, it's not still there. So it happened gradually. I was probably working on my eyebrows pretty frequently, like once a week, once every other week, which I know is probably too often, but I don't know, a couple of months. But I'm embarrassed to say I didn't keep really good track. It might've been 2 months, but it wasn't more than 4 months, but I was doing it more than once a month for sure. I probably did it about 6 times during that time.
Excellent.
And they've stayed. I haven't done them since. They're like, oh. So.
Thank you so much, everybody, for joining. It's been a great evening. Michelle, thank you so much for this. It's been hugely informative for everyone, I'm sure. You guys will see that Todd O'Leary posted the promo code in the chat for 15% off site-wide at losoms.com. Also in the chat is a direct link to AcuLift, Michelle's products. Visit her on her Facebook page, and we'll look forward to seeing you guys in the next free webinar.
Thank you, David. Bye-bye.
Bye.